The cervical clock exercise aims to train the patient's motor control abilities while also improving his range of motion. Improving motor control can decrease painful symptoms. To proceed with the new acquisition from the exercise section of the patient's screen, click on Cervical Clock. For the cervical clock exercise, the sensor must be hooked to the appropriate band, securely placed posteriorly on the head above the external occipital protuberance. Select the difficulty level for performing the test. Select the targets for the exercise by clicking on the corresponding number in the central ring. Finally, select the duration of the exercise and the number of repetitions for the patients to complete. The test begins with the patient sitting still in a neutral position with his head in front of the screen and the face in the center of the clock ring visible on the screen. Start the acquisition by clicking on Rec. The patient then carries out the exercise guiding the red dot display on the screen by moving his head, hitting the highlighted targets as precisely as possible. The test ends and the results are automatically saved when the trial duration or number of repetitions are reached. The report page is then displayed, showing the maximum range of motion reached, the precision the patient was able to hit the proposed target, and the average time to hit each target.